So now I think we can begin with the session. A very good evening or afternoon to all the participants, depending on which corner of the world you're watching this from. I'm Devika Dhopatkar, a second year BPharm student at NMIMS and a council member of IPASF. I'm the moderator for today's webinar. Before we begin, I would like to mention some housekeeping rules. We request all the participants to kindly keep their microphone muted and video off till the end of the webinar. All the queries are requested to be dropped down in the chat box, and as mentioned, e-certificates will be issued to all the participants who stay till the end of the webinar. I would now like to take this opportunity to welcome you all to this enriching international webinar on the occasion of World Heart Day. World Heart Day is an initiative by the World Heart Federation to create awareness about cardiac health. This year, the theme is Use Heart to Beat Cardiovascular Disease. I would now like to extend a warm welcome to our guest speaker, Dr. Rajay Narain, MRCP UK. Let me give a brief introduction about Dr. Narain before we begin. Dr. Narain is the founder and director of Global Health Alliance UK. He works as a cardiologist at St. George's Hospital, London. He has been involved in health and heart screening programs since 2005 at national and international level, and is also a member of the EAPCI, EAPCR, and a council member for stroke at the European Society of Cardiology. He is the founder and director of Heart Foundation and the UK Cardiovascular Innovation Network. Apart from that, he is also advisor to many government and private medical institutions in India and has presented papers at several national and international conferences. We are so glad to have you here with us, sir. Now I request you to take over the session.
Thank you very much, Devika, for the excellent introduction. And good afternoon, everyone, and good evening, people who are in the other part of the world. So my name is Dr. Rajay Narain, as Devika mentioned, and I'm a cardiologist at University Teaching Hospital St. George's, which is one of the biggest teaching hospitals in London. I did my graduation from India, but I've been in the UK for the last 20 years, and I'm working as a consultant cardiologist at St. George's University Hospital in London. So again, we all know that today is World Heart Day, and there is so much that we all need to know. Although we think that we know a lot about heart disease, in fact, we learn about heart disease on a daily basis. It was only recently that the European Society of Cardiology meeting, which was supposed to happen I think it was supposed to happen in Amsterdam, was done virtually because of the COVID situation. And there were about 88,000 cardiologists from across the globe who participated in the 3-day webinar meeting that happened at the European Society of Cardiology. And there was so much of discussion about heart disease and what needs to be done. It is also very important that we all understand the importance of heart disease, because there is a policy document which has been published by the WHO 3 days ago on the WHO website. So go on the WHO website, it is called Pulse WHO Survey. And what this survey tells you, that globally we are going to miss our target on every condition. Forget about heart disease. So malnutrition, maternal child health, vaccination. And when it comes to heart disease, diabetes, cholesterol, blood pressure, so things like non-communicable disease, we are likely to miss our target by up to 70% globally. That's a huge number. So we are already behind in our management and trying to screen people and prevent cardiovascular disease, especially in countries in South Asia like India, because India, as we know, that is the diabetes capital of the world. And having diabetes in itself can give you a lot of problems like heart disease, heart failure, coronary artery disease. So I'll try and see to convince you, to let you know that this is what we need to do. All we need to realize that we need to prevent heart disease at every opportunity, because prevention is something that is very, very important. Can you guys see my slide?
Yes, sir.
Excellent. So I don't know if you all know about this global burden disease. So this is something that you all need to know.
Sorry, sir. We are actually seeing
Sir,
your
we can
mail.
see your screen. We can't see the slides.
The present slides?
Yeah, no, sir. We are actually seeing your mail, Gmail.
Okay. Can you see it now? Can you say it now?
No, sir. It is like
Let me try again.
yeah.
Maybe I'll try once more.
Yes, sir. We can see it, sir. Yeah.
Perfect. So global burden disease, this is most important study that every healthcare professional needs to know. And I'm sure some of you in the audience must have read about it or heard about it. So global burden disease data was done by Professor Salim Yusuf. He is the global guru of data on heart disease from across the world. So he is now considered the global guru of heart disease because he has got data from 193 countries from across the globe. And what the global burden disease data tells you that what are the top 15, 20 killers now in 2016, 17, 18, and what will be the top 20 killers in 20 years time. And as you can see in this slide, the first two are heart disease and stroke. When you look at this slide at the bottom, the diabetes comes around number 14, 15. So diabetes is at number 15 at the moment, but going forward in 20 years time, diabetes becomes number 7. So hence diabetes will be more prevalent in 20 years time. And if you get more diabetes, you get more heart disease, you get more heart failure, you get more stroke. So that is why prevention is something that we all need to work on. I know at the moment everything is COVID and we are trying to fight COVID menace, but again, we cannot shift our focus from heart disease because this is something very, very important and we all need to focus and try and do preventive stuff because again, a lot of studies have been published recently at the EAPCI, at the American Heart Association guidelines, saying that prevention is much better, number one. And also, people who get stent or bypass done, they do not do as well as people who stay on medication and change their lifestyle. So again, lifestyle, eating the right food, exercising, it's all very, 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 very important. So what are the numbers like? If you look at globally, almost about 18 million people die from cardiovascular disease. That is almost 31% of all global deaths. So when I say cardiovascular disease, I mean heart disease and stroke. So again, the numbers are like around 18 million globally. 1/3 of death globally is because of cardiovascular disease. And these are our biggest health problems. So heart attack, kidney, diabetes, stroke, cancer. Because again, these are the main issues which are also very important when it comes to India. Because again, we see a lot of diabetes, a lot of heart problems, a lot of people ending up on dialysis because of kidney, a lot of cancer cases. This is a very interesting slide because again, this is a study which was published in JAMA in 2015. So it shows you about a person who's eating healthy and having a healthy lifestyle and carries on with healthy lifestyle for another 20 years after 60 years of age. So again, till the age of 60, he has been doing a lot of exercise, eating the right food, doing all the right things. And you can see that he has a good life up to 80 years of age. The moment he developed diabetes, you can see some of those cakes disappearing on the top. So he's already lost 6 years of his life because he's developed diabetes. Because people with diabetes, they develop microvascular or macrovascular complications. If he develops heart disease, which we know that people with diabetes develop heart disease, you lose another 12 years of your life. So again, you can see more cakes have disappeared on the top. A person who could have lived up to 80 has already lost almost about 12 years of his life because he developed diabetes. And after that, he developed heart disease. So what are our risk factors? And I'm sure most of you know this. Blood pressure, cholesterol, obesity, weight, smoking, diabetes, family history, stress. Stress is again very, very important, especially in the current scenario, because a lot of us are suffering from stress and mental health issues, staying in the house, not going out of the house, not having normal lifestyle, and hence a lot of us are suffering from stress. So what can we do to prevent high blood pressure? And I'm sure there may be a lot of family members that have got high blood pressure in your family or friends. And this is what we can do. Increasing your physical activity. When I say that, have a look at the European Society of Cardiology guidelines, which was again published only 2 weeks ago. And that says that any healthy adult should be doing at least 150 minutes of exercise, moderate intensity every week. So all of us should be doing 150 minutes of moderate intensity exercise or vigorous intensity exercise of 75 minutes. So again, you have to choose. When I say moderate, it means that you go on a treadmill or you go jogging in the park, but make sure that your heart rate goes up at least by 1/3 of your resting heart rate. So even if a resting heart rate is around 70s, make sure that you are running and jogging and keeping your heart rate above 100 for the 15-20 minutes that you are jogging. So again, 150 minutes is the number to remember. That is the guideline from the AHA, from the ESC, from all the global world authorities on cardiology, that you have to do 150 minutes of moderate intensity exercise every week. We all know that it is also very important to keep a very healthy weight, and we should try and cut down on the salt in our food. Cutting down alcohol is also very, very important because that can lead to hypertension and high blood pressure. Balanced healthy diet, again, is a very important thing we all have to understand and realize, and I'll present a slide later in my presentation talking about the Pure Heart study, which was done mainly looking at the diet side of things. When it comes to cholesterol, we know that there is good cholesterol and there is bad cholesterol. So LDL is our bad and harmful cholesterol, and we have to try and keep it as low as possible. HDL is our good cholesterol and a cardioprotective cholesterol. So again, all of us, if you get your lipid profile test done, make sure that your HDL, which is the good cholesterol, should be more than 1.5. It is very important to keep your good cholesterol as high as possible, because there are lots of studies now to show that if you keep your good cholesterol high, you prevent yourself from having a heart attack, even if your bad cholesterol is slightly high. So as long as you keep your good cholesterol on the higher side, you are kind of protected. And there are only two things that you can do to improve your good cholesterol. One, 150 minutes of exercise every week, and eating food which is rich in omega. So things like fish and omega-3, 6, 9 capsules that you can get over the counter or in the pharmacy. So those are the two things that we need to remember to keep our good cholesterol as high as possible: exercise and fish and omega-rich diet. When it comes to weight, there's no magic pill for it. We have to try and keep our BMI safe, and we all know that we have to keep our BMI between 20 and 25. Above 25, you are overweight. Above 30, you are obese. So again, try and work out your height, weight, and see where you land up. You should try and keep your BMI between 20 and 25. An effective weight loss plan should be there by using lots of exercise, things that you can go to the gym or do your jogging, whatever you want to do on a regular basis. And always try and avoid crash diet, because that has a bad effect on the heart and the body overall. Smoking is the biggest thing that we can do to stop the risk for cardiovascular disease and coronary artery disease. You can see people who smoke on the right side of the screen, how they clog up their coronary arteries and block their arteries, and that leads to coronary artery disease and heart attack. Diabetes, very important for us, especially in India, because we know a lot of people suffer from diabetes. It is the diabetes capital of the world. So again, at least 30 minutes of exercise 4 to 5 times a week is very, very, very important. It can bring down your HbA1c and help you manage your diabetes better. Eating a healthy, balanced diet is also very important. And obviously, we have to control our weight and body shape as much as possible. Smoking, again, can lead to bad diabetes control, and hence the smoking causes inflammation in the arteries, and that can again precipitate lots of coronary artery disease and lots of problems. Stress, as we discussed, that it is very important to have a positive strategy to deal with your day-to-day stress by keeping yourself physically active. That is one thing that you can do to get rid of the stress. And on top of that, it is also important to have a balanced diet, a good sleep. And I say good sleep, I mean at least 7 hours, if possible 8 hours. But again, I know young people cannot sleep more than 7 hours. So 7 hours is a must. Most of the studies have shown. Some physical activity is must, and a balanced diet is must. This is what can help you to fight stress better. So these are few of the important slides. Again, this was published by the Harvard University recently. 7 ways to reduce your stress is to try and get good sleep, learn relaxation techniques like yoga, strengthen your social network. I'm sure we are already on top of our social network already, and have time management skills. Try and resolve your stress in a planned way. Nurture yourself, spoil yourself, do things that you like doing, and always encourage people to try and seek help. One of the biggest problems in India, and I don't know because I keep going to India quite frequently, that people who suffer from depression or mental health issues, they never seek any help. And that is why it is very, very important that we should try and seek help when we think there is a help required, because again, there's no harm in seeking help. Just like you take help from a diabetes doctor or heart doctor, if you have mental health issues, if you have depression, you need to seek help. And I can't emphasize this any further. Exercise, exercise, exercise is a must. This has been published every year, including this publication, which was done by our group some time back, because exercise can help fight with your cardiovascular disease, with your cancer, with your musculoskeletal osteoporosis, falls, disability long-term, help you reduce weight, reduce your diabetes problems, reduce your LDL cholesterol, which is the bad cholesterol, increase your HDL cholesterol, which is the good cholesterol. And then obviously it also helps you to reduce the risk of stroke, cognitive function problems, and dementia going forward. So as part of this, we have set up an initiative in India called the Your Health Matters. We have got few of the best of the experts from the UK who advise people on how to keep themselves fit and healthy. It's called Your Health Matters. We have got the best of the cardiac rehab specialist nurses who deal with people with coronary artery disease, diabetes, obesity, bad lifestyle, to advise them how to improve their lifestyle. We've also got a dietitian and a nutritionist, okay, who again is very good in telling people what is the right thing to eat. We have got a person who can deal with your stress management. And from the heart disease side of things, I do a lot of discussion, talking, and consultation with people in India. So this is again very important study that we all need to know. This is the biggest study done on diet till date. It is called Pure Study, but people call it Pure Heart Study because it has got so much advantage on the heart. So Pure Heart Study was one of the biggest study done on diet to tell you what is good for heart. So this had 218,000 participants in 50 countries in 5 continents, followed over 10 years to see how people do when they are on the right diet. And the key finding was that high carbohydrate, so a lot of rice people that eat in India is not good. So carbohydrate intake increases your total mortality. High saturated fat intake is linked to 21% lower risk of stroke. So what is important to know? Important to know is that there should be a balanced consumption of fruit, vegetables, nuts, legumes, fish, dairy, and unprocessed meat. And these are all good for heart and is linked to lower mortality and lower cardiovascular disease. So again, you should have a balanced, healthy diet, which consists of fruit, vegetables, nuts, legumes, fish, and unprocessed meat. So this is what we need to know. This is what is important for us to live longer in a healthy way. And I'm sure this is very, very important for most of us because there is so much of study out there saying that a glass of wine every night, especially red wine, is good for heart. So I always get patients in my clinics asking that, doctor, I think a glass of wine every night is good for heart. Is that right? That brings down my cholesterol. And the answer is out now because this again is the biggest study published till date, clearing all your confusion and doubts on alcohol. And I'm afraid it's not good news for most of us. This was the biggest study done, global burden disease data, which we were talking about earlier. So this was part of the GBD study. It was a 26-year follow-up study. So again, the biggest study done on diet and exercise and what is good for heart. And when it came to alcohol, the verdict was unfortunately very bad. Any amount of alcohol is not good for heart. So when people come and tell you that, yes, I'm having a glass of wine every night, a red wine to keep my heart healthy and to bring my cholesterol down, tell them, read the global burden disease data. Any amount of alcohol is not good for heart. Alcohol increases your risk for cancer and cardiovascular disease. It is the 7th leading cause of death globally. So what's good for heart? Healthy, balanced diet that we discussed. Yoga again has gained a lot of fan around the Europe especially and in England, because the British Heart Foundation now tells you to do some yoga post cabbage, post bypass surgery, post stenting. So again, yoga is important. Nuts, some amount of nuts is very good for heart on a daily basis. And again, walking and exercising is something that we all need to do more and more. So on that note, I would like to end my talk and I'll be happy to take some questions. Thank you very much.
Now we request the participants to put their questions in the chat box if they have any questions. I will read out some of the questions that we are getting.
So we can unmute people as well. If people want to speak, if there's somebody who wants to speak, then they can raise their hand or ask some questions.
We already have a question
Okay.
from someone. The person is asking, as per the current status, 1 in 3 global deaths are due to stroke. Can we prevent all these by reducing stress or by following diet?
So again, you have to balance out, because again, just by reducing one risk factor, you cannot prevent the stroke. For example, if a person is a smoker, that in itself is a big risk factor. And if a person has a sedentary lifestyle and he does not do any exercise, that again is a very big risk factor. So he may not be a diabetic, hypertensive, or any other medical problems, but he does not do any exercise. So having a sedentary lifestyle in itself is a big risk factor for heart disease and stroke. So again, whatever we discussed earlier, whether it be diet, exercise, managing your stress, doing regular exercise, all that is very important to prevent heart disease and stroke going forward.
We have another question. What are the common signs and symptoms that we should look for heart disease?
So when it comes to heart disease sometimes can be tricky. Majority of the people who present with heart disease, they present with shortness of breath. So again, they were able to walk about a kilometer before, and they are now getting breathless on walking just possibly a few hundred yards or half a kilometer. So if they complain of shortness of breath, if they complain of chest pain, chest tightness, heaviness in the chest, these all should make you think whether it is heart related or not. Again, people sometimes can just present with jaw pain, arm pain, neck pain. So again, left side jaw pain, neck pain, and arm pain can be a presentation of coronary artery disease. So, but majority of the time it is chest heaviness, tightness. When you ask the patient what the symptom is, they put their hand in the front of the chest and say that this is like something is sitting on my chest. Somebody has put something on my chest, or tightness in my chest. So that's what people present with most of the time.
One more question. Will the youngsters also get prone to these heart problems due to educational stress? If yes, then what remedies should we follow?
I don't think educational stress can give you heart problems, but yes, it is very important that you take things easy, because passing your exam and getting the best grade in your exam is not the only thing that you should aim in your life. That is very important, but should not be the only goal, because again, if you make that your only goal, that you're not going to be successful in life. I did my MBBS possibly 25 years ago. Nobody is coming and asking me that how many attempts did you take in passing your MBBS, or how many attempts did it make you to get into the NEET exam and get into the medical world. Nobody bothers, because what matters is what you are doing now. Because again, I understand that India is such a challenging place to get into any professional life. It is so challenging, but I think it is very important that we strike a right balance and do all what we need to do, but in a balanced way.
Next question. What would be the first aid for heart attack? Rather, is there any first aid for heart attack?
It depends. If that person who's having a heart attack is only having chest pain, then obviously you should try and give them 300 milligram of aspirin, number one, and try and take them to the nearest hospital. If they're having a cardiac arrest, then obviously you have to try and start doing a CPR and basic life support. So it all depends on what the presentation of the patient is. If they're only complaining of chest pain and tightness, and they're talking to you, and you feel that this is like bad central chest pain that feels like heart attack, in a person who's likely to get heart attack because he's got risk factors for coronary artery disease, you should give them 300 milligram of aspirin and rush them to the nearest emergency department.
And we have yet another question. What is the percentage of attaining cardiovascular disease when a person is already suffering from diabetes and is already on medication? Also, what is the needful to be done to prevent it?
Very good question. And as I said earlier, that there are a lot of data and evidence now that not only heart disease. So when I say heart disease, that only does not mean blocked arteries and coronary artery disease, because people with diabetes are more likely to develop heart failure. So how do they develop heart failure? So if I have diabetes, it is not necessary that I will get blockage in the arteries. My arteries may be clear 20 years later, but I still may develop heart failure. So heart failure is something that the heart muscle becomes very weak and is not able to pump good amount of blood. The normal ejection fraction of the heart should be 55 to 60%. And people with diabetes, they gradually develop diastolic heart failure, which is the way the heart relaxes, because there's a lot of fibrosis in the heart muscle. Because of diabetes, they develop diastolic heart failure. Diastolic heart failure means that the heart relaxation suffers. And when that happens, the amount of blood that the heart can generate to pump next time goes down. So your pumping may still be good, but the amount of blood that you can generate by relaxing your heart and pumping again goes down in diabetes. And hence it is important that people with diabetes, they have to be managed properly. Their HbA1c should be less than 7.5 or less than 42 most of the time, whatever the number, millimoles or milligram per deciliter. So 7.5 or 42, it should be less than that. If you don't control diabetes properly, you're likely to develop, 3 times likely to develop coronary artery disease or heart failure going forward.
The next question is, why are heart diseases more common in women?
It is not more common in women. People have this misconception. Women after menopause, after 45, are more likely to get coronary artery disease. Heart disease is more common in men. But when it comes to women, the way the management is done in women in coronary artery disease, unfortunately, has not been done properly in most of the world, especially in developing countries. So again, there's been a lot of discussion, publication, and meetings and conferences discussing about how to best manage coronary artery disease or heart disease in women. There's no data to say that women get more heart disease than men. It is men who get it, because again, men have more bad lifestyle, more smoking, more sedentary lifestyle. So again, it is more common in men.
Another interesting question, will long-term use of anti-diabetic drugs like oral hypoglycemics lead to heart problems?
Not at all. Read the FDA guidelines. FDA is the American guidelines body which makes your guidelines. So FDA basically said in 2009, when there was problem with the drug called rosiglitazone that causes heart failure. So when people with rosiglitazone started getting heart failure in 2007 and 2008, FDA made it a necessity for any diabetes drug that comes out from 2008 onwards, they have to show cardiovascular benefit. They have to show good cardiovascular outcomes. So any diabetic drug that exists in the market at the moment, they all have got, if not all, 99% of them have got good cardiovascular outcomes. And when I say that, I'm pleased to say that only yesterday I have set up a new clinic at St. George's Hospital, which is the cardiometabolic clinic, where we look after heart patients, diabetes patients, high cholesterol patients, obese patients in one clinic. As you may know, some of you may know that there's a new group of drug called SGLT2 inhibitors, like drugs like dapagliflozin, empagliflozin, ertagliflozin, which has come out recently. And there is so much of data on SGLT2 that it is a magic drug for heart. So what SGLT2 inhibitors do, so proximal tubule in your kidney has got intensity or tendency to absorb glucose. So when you develop diabetes and if you give somebody SGLT2 inhibitor, that inhibitor goes and sits in the proximal tubule and blocks this absorption pathway, and hence you lose your glucose. So when your glucose goes out in the urine, you also have osmotic diuresis and you lose fluid as well. So when you're losing your glucose, the water comes out, and when the water comes out, your blood pressure drops. When the water comes out, your edema from heart failure gets better, and hospitalization for heart failure gets better. So it's a magical drug which has come out recently, which is called SGLT2 inhibitors, drugs like dapagliflozin, empagliflozin, which are very good, canagliflozin, which again can be given in people with renal impairment as well. So these drugs are magical drugs, and this is the talk of all the cardiology bodies globally, because this is a magical drug which is working like a magic in heart failure patients, being a diabetic drug.
Can hemorrhage cause heart attack problem? And if at that time, should the patient be treated with aspirin?
Hemorrhage where exactly? So let's have a look at the question. Can hemorrhage cause heart attack problems? And if that time, should patient be treated with aspirin? I'm not sure what they mean by hemorrhage. Do they mean hemorrhage in the brain, or do they mean hemorrhage in the...
Brain
So
hemorrhage, sir.
possibly brain hemorrhage. I think they mean possibly brain hemorrhage. Brain hemorrhage can sometimes trigger heart attack, yes. And at that time, if they need to be treated with a stent, a best strategy is worked out between a neurologist, depending on the amount of bleeding and the hemorrhage that they have on the MRI. And depending on what the amount of bleeding is happening in the brain, a strategy is developed if the person needs a stent or not. So they have to be taken to the cath lab to look at the blood supply to the heart. And depending on how much bleeding that they have got in their brain on the MRI, you decide the best strategy in the best interest of the patient when it comes to dual or single antiplatelet agents.
The atrial septal defect, which is being seen in infants, can it recover by itself without surgery with time or with age?
So again, lots of studies have been done. That atrial septal defect again is the hole that is between the two atriums. And what happens, there has been a lot of studies in the past saying that if you have a big ASD, you're likely to pass a clot and you may get a stroke. But majority of the studies now show that even if you've got a small ASD, it's a VSD which closes with time. It's not the ASD. So ventricular septal defects, they close normally at the time of birth or later part of the life. ASD can sometimes close at the later part of the life, but majority of the time, it is the ASD which is the cause for discussion and concern, unless the VSD is big. So ASD is the top chamber of the heart, the atria of the heart. There is a hole between the two chambers of the heart on the top of the heart. So most of the studies have shown people used to use a lot of mesh, a net kind of thing to block that hole. But most of the studies have now shown that it does not affect, it does not cause stroke long term. So again, small ASDs can be left alone. Nothing needs to be done.
What are the standard guidelines and protocols that should be followed for treating cardiovascular problems?
So if one guideline has to be followed, which is good evidence-based, it is the European Society of Cardiology. So do a Google search. You all can become a member of European Society of Cardiology. It's free to become a member of European Society of Cardiology. If you become an ESC member, then you get a lot of access to educational stuff, especially now, because there has been a lot of changes in the way we used to treat patients with heart disease. There's been loads and loads of new guidelines which has come out at the ESC meeting recently. Hence, I would strongly recommend that all of you should go on to the European Society of Cardiology guideline and see there are loads of new guidelines on anything that you want to read about, whether it be AF, whether it be ASD, whether it be coronary artery disease, hypertension, everything is there. There's another question I can see, that are fibrinolytics best choice for STEMI? If yes, which one has the best efficacy? So the new guidelines around the world is that when you are having a STEMI, which is ST elevation myocardial infarction, you should have a stent in the first 90 minutes for long-term benefit and preventing any heart muscle damage. So doing a thrombolysis with drugs like tenecteplase or alteplase, whatever you want to use, is something that used to happen in England 20 years ago. We have not been thrombolizing for last 15, 20 years now. It is rarely used. If a person gets a heart attack in a village where there's no access to helicopter or ambulance service and they cannot get to the hospital in 90 minutes, rarely it is used. And I'm sure it is still being used in some parts of India. But the best treatment for STEMI that you can get is to get a stent to the blocked arteries within the first 90 minutes to prevent any long-term heart failure symptoms. What are the emergency medications used in stroke and CAD? So again, most of the evidence is to show that antiplatelet agent is very important. Statins is very important because statin is a drug, especially atorvastatin has shown a lot of evidence lot of studies are around statins to tell you that statins are the best statins to prevent long-term progression of coronary artery disease or blocked arteries anywhere else. What are the effects of COVID-19 on heart? COVID-19 on heart causes heart failure. COVID-19 on heart sometimes can cause myocarditis, which is inflammation of the heart muscle that we talk about. So we have seen lots of cases where people have presented with myocarditis, and myocarditis is basically inflammation of the heart muscle, where it leads to heart rhythm disturbances and heart failure. So we are seeing loads and loads of patients coming post-COVID with myocarditis and heart rhythm issues. So I think we'll have to wrap up this session soon because I need to go. I can take one or two more questions if, Devika, if you want me to take one or two more questions quickly.
Sir, I think we can wrap up.
Okay.
So
It's been, hopefully it has been of some use to you guys, and it was a pleasure to connect. And it will be good to speak again on some important topics in the future if you guys want me to speak, and we can in fact get more people to be part of your organization and connect you with more people who can do some teaching for you guys. So it was very useful interaction, and hope it has been of some use to you guys as well.
yes, sir, definitely. So due to shortage of time, we are now ending the Q&A session here. And now I would like to conclude this session with a small vote of thanks. Firstly, I would like to thank our guest speaker, Dr. Rajay Narain, for accepting our invitation at such a short notice and sparing time from his tightly packed schedule. And we are really privileged to have you here in today's session, sir.
It's a pleasure.
Thank
Thank
you.
you so much.
Thank you, Mr. Suman Singh and Ms. Jennifer for helping us with the coordination of this event. Next, I would like to thank our mentor and guide, Dr. T.V. Narayana and Dr. S. Vidyadhara sir, for their immense support and guidance. Also, a big thank you to Dr. R.N. Gupta, the chairman of IPA Hospital Pharmacy Division, for gracing this occasion. I would also like to thank my entire team of IPASF for all the hard work, dedication, and cooperation. This would not have been possible without our teamwork. And last but not the least, I would like to thank our dear audience for attending this webinar. I hope you all liked it, and feel free to send us your feedback at ipsfactivities@gmail.com. And you can also follow us on Instagram, subscribe to our YouTube channel, and like our page on Facebook for receiving updates on our upcoming events. And as already mentioned, the certificates will be issued to all the registered participants within 3 to 4 working days.
Thank you so much, everyone. And it's a pleasure to connect with you and your association, and look forward to more interaction in the future. Take care.
Thank you, sir.
Bye-bye. Bye.